It's a blessing because without it, I don't even know if I'll be living, really, seriously.
If it hadn't been for the clinic, there's a possibility that I might not be able to see well enough to drive exists. The possibility that we would be in debt, just huge debt.
I don't know what I would do, I'll tell you the truth, be honest with you.
I get very emotional when I think about that because they took me from a place that I was not able to do anything to a place that I'm now able to do so much for others.
Western Tidewater is a medically underserved area of Virginia. Thousands of residents live in the gap of health care. No Medicare, no Medicaid, and no insurance. For years, there was literally no affordable place for some people to turn for medical care, and lives were being lost.
If you're working 2 or 3 jobs and none of them provide health care for you and your family, then you really are going to have to choose between food and medicine.
In 2007, Western Tidewater Free Clinic opened its doors thanks to a concerned and committed group of community citizens and organizations. The clinic was now the first and only free safety net healthcare provider in Western Tidewater.
The acuity of the patients that we saw at the very start, I think, astounded every one of us. And now that we can see those patients on a routine basis and they have access to medications and they've gone to work and they've done things that they've always wanted to do, you can't even put a price tag on what we do.
There were really almost no safety net providers. Folks had nowhere to go, almost nowhere to go but an emergency room to get basic health care. And that really was people's recognizing the great need in the community was what started the clinic.
Obici Healthcare Foundation gave the clinic a substantial portion of its initial funding and continues to be the clinic's largest annual funder. And Centera Obici Hospital is the largest medical partner, providing numerous critical free services annually.
The clinic fills a large gap in the community. So some patients may be discharged from the hospital and they don't have medication, they don't have a follow-up physician, where now they can come here and have their medications ordered for them. They have good physicians, nurse practitioners to see them, and they really appreciate that.
Western Tidewater Free Clinic is a true health home to our patients who receive comprehensive health care services here, including medical, dental, and vision care, women's health services, medications, mental health counseling, physical therapy, and one-on-one patient education.
Diabetes, blood pressure, and cholesterol. Keep a check on all that stuff.
They help me with going to my yearly visits, to the lab works, everything. I get my eyeglasses through them. They gave me my free dentures. I would have never been able to get those as much as they cost.
It's the first time I had an eye exam. My whole life, I'm 58 years old, and it's a blessing, to be honest with you.
That a lot of these patients that we see, if they don't have a treatment here, they don't get any other treatment anywhere else. So I feel like we do a big service for the community, for the patients, and not able to see our dentist.
Without providing the free medications that we do to our patients, they would not be able to function on a day-to-day, week-to-week basis.
In addition, the clinic's partnerships ensure patients can be referred to on- and off-site specialty services, including surgery, and to other community-based safety net agencies.
I came for a couple of reasons. I had needed blood pressure medication, have a little high blood pressure, and I had this bump on my nose. And I wanted them to take a look at it because it seemed to, in the last year, change or so.
Catherine's concern was warranted. Clinic doctors took a biopsy and learned it was basal cell carcinoma. They referred her to a surgical oncologist who removed the lump and then to a plastic surgeon to reconstruct her nose.
The quality of my life is much better. This was a terrible worry. and I had no way to do anything about it. But with their help and their maneuvering and got me around, I got the help that I needed.
The clinic has filled a void since it opened in 2007, serving thousands of Western Tidewater residents and dispensing millions of dollars in retail value of prescription medications. Through community support from volunteers, donors, and partners, patients' lives are changed at the clinic, one visit at a time. But there is much more to do. Western Tidewater is a vast area of 1,400 square miles and includes Suffolk and Franklin, along with Isle of Wight and Southampton counties. So, in addition to health issues, just getting to the clinic can be a challenge. With community partners, the clinic is working to overcome that.
It ain't easy to get here, but you catch the I-Ride bus, it ain't too bad for paying them to come and bring you and pick you up and bring you back.
The reason that the Western Tidewater Free Clinic matters to this community is because there's about 7,000 to 8,000 people that are our neighbors that don't have an ability to take care of their own medical expenses. And that's people that are vital community members. And when they don't get the help they need and they are not able to care for their own health, our whole community suffers.
This is the Western Tidewater Free Clinic calling.
Clinic staff and volunteers work side by side to provide patients with high-quality care and personal attention. From nurses and doctors to registration, medical records, and administrative tasks, the volunteers get as much or even more out of their time at the clinic than the patients.
We have people who are coming together, doctors and nurses and pharmacists and dentists and even hospital systems who are coming together who say, hey, we have a need here and let us work together to serve this need.
Here where you have less, more people say thank you. They are truly grateful. When somebody looks at you and they say, thank you for volunteering here, it really helps you to understand what your purpose is here. And that is the importance of volunteering.
I get out of this just knowing that I'm helping somebody else. That's all what it comes down to. No matter how small it may be, just the fact of knowing someone has been helped in some small way matters to me.
For me, a career in medicine is it's based on service to other people. So it's not so much a question of what I get out of it, it's just I'm meant to be here and I'm meant to be doing what I'm doing here.
Western Tidewater Free Clinic stands ready to meet the future health challenges of the region. More resources means greater access to health care and more lives changed and saved.
In order for us to reach out and touch that 75% of the potential base that we're not helping today, we're going to have to do two things primarily. One is we're going to have to make sure this facility is being used to its fullest capacity. Secondly, there's some patients in Southampton and Isle of Wight County. It's a long trip for them to make to get here. And if we can put ourselves closer to where they are, that will help us do a better job of serving those needs.
I think there will always be a need to provide health and care and dental care to those people who do not have it. We're here to be a resource. We're here to be that safety net.
People tell me I'm passionate about the clinic, and I am. When I think about the lives that are changed, it kind of wells up inside of you, and it makes you feel like you really are making a difference.
It's a great place to come. For your teeth, for your eyes, your checkup, your medication, you can't beat it. It's a wonderful place to come. Treat you like family too.
Yes, our name is Western Tidewater Free Clinic, and we are free for our patients because of their socioeconomic situation. We don't charge them for their services, but it is not free to run this clinic day in and day out.
I didn't have anything. I didn't have insurance and I didn't have income. So the clinic helped me, and we should all help the clinic. We should all support and put that money out for the clinic.
The clinic will continue to grow based on community need, but we can only do that by growing our resources of volunteers and funding. Your support will help us care for the thousands of lives in Western Tidewater that still need our helping hands. Health, hope,